Howdy guys. I also promised to look at what different handwriting styles also say about different people's health. And just so you know, the information that I'm just about to give, and even if you look at it, you're told that you should not use it for self-diagnosis. So even if you see that you have some of these symptoms, do not self-diagnose yourself. You should see a doctor or an expert. So we're looking at diseases like high blood pressure, we have Alzheimer's disease, we have schizophrenia, and then lastly there's the Parkinson's disease. So let's begin with high blood pressure. So for high blood pressure, symptoms include writing with variable pressure. We already talked about writing pressure, so you already know what we're talking about. So writing with variable pressure, and this is especially when it moves to light pressure to high pressure. So this is one of the indicators. So high blood pressure, we were looking at the writing pressure. The Alzheimer's disease, which is related to gradual memory loss, we're told that one of the many factors includes handwriting that changes to irregular or altered letters that are coupled with trembles in writing. So if you see that, it means that probably your child or yourself could be suffering from Alzheimer's. Okay, so if you look at the pattern in which your writing somehow gets irregular or your letters are altered, and also we're told that the writing somehow, I think in terms of speed, also slows down. The next disease or disorder is schizophrenia. We know that this is a disease that affects our ability to feel, behave, or think clearly. And this one, we're looking at how you're writing. So the slanting of your letters, we're told that when the slant varies within a sentence or within the same word frequently, then it means that probably you have schizophrenia, because this will mean that the person is not having continual contact with reality. So we're saying that you're not able to think clearly. So that is for schizophrenia, what your handwriting has to say about it. The last one is the Parkinson's disease, and this is a disorder of the central nervous system that affects one's movements. And for that, it means that we have those people who write micrographically, meaning that you write with very small or cramped handwriting. So that means that it could be a symptom of Parkinson's disease. And also sometimes the handwriting can become so small that even you as the writer or that writer cannot actually read it. So when you look at these symptoms, when you look at the handwritings, then it means that somehow the symptoms of these diseases are setting in. I thought it's also important to note, because most of the times we overlook stuff and maybe they might be important. So that's what I wanted to tell you for now. So until next time, Insight with Pape Massa bids you farewell. Good night.